My name is Agnes Gantz. I am an emergency department nurse, and I've been at Legacy Emmanuel for almost 8 years. I decided to be a nurse for a couple different reasons. First and foremost was I loved the sciences, and I loved being a Sherlock Holmes to help find out what we needed to do to help patients be better. But over time, that's evolved. And now if you ask me now after 26 years, I would say I love to be a nurse because I love the people I meet, the patients I help, and the experiences I have because it's made me who I am. The most rewarding thing about being a nurse is not just the smiles and the thank yous, but I think that one of the more rewarding things is finding that what I do, it is part of someone else's experience, and the experience they have with me will follow them through their discharge home and help them to hopefully not come back, but hopefully to understand themselves and their health a little bit better.
My name is Briar Walsh. I'm a registered nurse at Legacy Medical Group Cardiology, and I work at our Mount Hood location in Gresham. And I've been with Legacy for 7 years. I decided on a career as a nurse back when I was working as a medical assistant. When I first got into the medical field, I remember working with a patient who had heart failure, and he was a candidate for a heart transplant. And I remember the first time that I took him back to the exam room and talked with him, and I measured his pulse and I could barely feel it. And he was just so sick and just very discouraged, but hopeful that he was a candidate for a transplant. And then seeing the transition after he had the heart transplant and came back to see us, I remember checking his pulse after that and just being so excited about just feeling this bounding pulse, and there was life, breathed back into him. And just seeing the transformation with him and what it did for him and his family, and then all of us at the clinic, it really just made me want to do more and inspired me to become a nurse. I find many things rewarding about being a nurse. Probably the biggest thing is the relationships that I build with our patients, and especially working in the clinic, I get to see the same people over and over again, and I talk to them on the phone all the time, and then see them in the clinic, and it just is really nice having that connection and being one of their go-to people for the questions that they have regarding their health care or their diagnoses. And a lot of times it can be very confusing and hard to navigate, as we all know, and just trying to be there for them as a support person and clarify and answer questions. It just is really rewarding for me. And I just love working with people. And then one of the biggest things that I love about being a nurse at Legacy is the nursing team that I work with, and all the providers and all the staff here. It really is a team effort, and I feel valued as a nurse and part of the team.
Hi, my name is Forsyth, and I work as a registered nurse at Legacy Good Samaritan Medical Center on the Progressive Care Unit. And I've been doing this gig for about 8 months. I'm a new grad, I'm fresh out of school, so here I am. I went to Oregon State University first, and I thought I wanted to be a mechanical engineer and design cars and do stuff like that. But week 3 of the first term, I figured out that was not for me, and I wanted to do something a lot more people-centered. And I still love science and love serving people, so nursing is the best of both of those worlds. A couple things I really find rewarding about being a nurse is connecting with people, whether that's a patient or a family member, and just forming a therapeutic relationship with them. Another thing I enjoy is serving the underserved. On my unit, we see a lot of folks experiencing homelessness and mental illness, and I really enjoy serving that patient population. In my opinion, those people aren't well taken care of in society, and so showing them love and kindness is something I really enjoy. Another thing that's rewarding about nursing is seeing patients get better and seeing them discharge and get out of the hospital, and then reflecting back on what I've done to influence their care and get them home.
Hi, my name's Erin Potter, and I work in the emergency department at Meridian Park. I've been with Legacy for 17 years. The reason I chose nursing in part was because my mom was a nurse. So she used to work for surgeons and she told really interesting stories at the dinner table, sometimes a little gross, but it got my interest. I do enjoy caring for people and giving back to my community. They come to the emergency department on either the worst day of their life, or maybe they just had an unfortunate accident and they're here and need a little bit of humor. That's what I'm here for, to provide good care, a sense of humor, a handhold if need be. And that's what I find rewarding about nursing, is that I can give back in that aspect. So I'm happy to be here with Legacy and happy to be a nurse.
Hi, my name's Nan Beckwith and I work in the emergency department at Meridian Park. I've done so for 25 years, but I've been a nurse for 47. Why did I become a nurse? I was motivated because my grandfather was a physician, and just to see him making house calls, having a rapport with families was wonderful, which is one of the reasons that I chose the emergency department. We actually get to establish a rapport with the family, with the patient, and you get to delve into why are you here and what brought you to this emergency department, and you get to enjoy them from beginning to end. And that's why I became a nurse.
Hi, I'm Hillary Rule with the Surgical Specialties Department at Meridian Park. I have been here for 10 years, and I first became a nurse because when I was 17, I had a large back surgery, which brought me a week in the hospital. It really exposed me to the profession of nursing, and I realized at that point that nurses can make such a difference in a patient's life. I noticed the difference between an extraordinary nurse and an average nurse, and I wanted to be one of the extraordinary ones. I find it really rewarding when I can make a difference in a patient's life and use my knowledge and skills, kindness and compassion to affect people's everyday lives.
My name is Nicole and I'm a nurse at Randall Children's Hospital in the neonatal ICU. I've been with Legacy for 7.5 years. I've always had a passion for kids and working with kids, and I went back and forth between being a psychologist and a teacher and a nurse, and I shadowed my cousin who was a neonatal nurse practitioner, and I fell in love with nursing because I have the ability to have compassion and teach mamas and take care of the sweetest little miracles, and it brings me so much joy to just see them grow, and they are just struggling for life and their miracles, and they inspire me every day to cherish every day, and it's very rewarding to be a nurse in the NICU.
I'm Katie. I work in the pediatric day treatment unit at Randall, and I have been with Legacy just shy of 15 years. I became a nurse actually not really knowing what it meant to be a nurse. I just knew that I wanted to work in the medical field and help take care of people, and that has just been beyond anything I could ever ask for, to be able to help at the bedside with kids. One of my greatest joys and rewards of being able to be a nurse is just the journey that I get to go on with families, whether it's the hardest day of their life when they hear a new diagnosis of what their child has been diagnosed with, to being off treatment, walking out of the hospital after being in the hospital for months, sometimes even a year, and to know that I've been able to be a part of that journey, whether it's really, really hard days, amazing days, the first time they stepped out of their bed, which can be the biggest day for a very long time. They may not have been able to do that for months and months. So it's just really fun to go on this journey and have them teach me every single day also. And I'm humbled by these families and all of the patients that I get to take care of. And it's just a great reward to be able to have them in my life.
I'm Kim McKinnon. I have been a nurse for Legacy for 14 years. And I work at the Family Birth Center at Salmon Creek. I decided on a career as a nurse because of my twin sister, who had some illnesses and injuries as a child that required some hospitalizations. And when she came home, she would tell me all about the nurses that she had taking care of her. What I find most rewarding about being a nurse is that I get to take care of people in their happiest times and some of their hardest days, and it seems to be sometimes more rewarding for me and exciting for me than it is for them.